So the My Spirituality group is a group that runs on inpatient psychiatry units once a week usually, and it's specifically geared for patients who have been admitted to the hospital because of mental health concerns. It's a chance for them to talk about their spirituality in a safe place where they can be vulnerable, where they can share their concerns, and where they can gather as a community together.
I've had many special experiences as being part of the group, and I think it's helped to change how I see myself in the group. When I first started the groups, I thought, I'm the teacher, I'm the leader, and through the course of having these experiences, it became more clear to me that we are pilgrims on this journey of life. And there's been times that I've been really blessed by experiencing and hearing the stories and the sharings of people in the group.
Most of them feel quite comfortable. It's quite interesting too, because the patients who are very quiet and don't tend to talk a lot also contribute. So I guess they must feel safe enough to do that. And they communicate with us as chaplains very, very well. Sometimes we need to initiate conversations or keep them on track because they will wander off a little bit with whatever illness they have. But typically they're quite open to discussing, and then they affirm each other as well. So they're quite encouraging for one another, which I think is really fantastic.
I do think that the word that summarizes how patients interact with one another is compassion. We go over group values at the beginning of every group, and I'll talk a little bit about respect and what does respect look like. And so it's basic things like not interrupting somebody else and recognizing that we all have different values and that we can respect one another without agreeing. But then we take it a step farther when we talk about what does compassion mean, and it's more than just tolerating somebody, but it's recognizing that each of us are on a journey and that sometimes we're having pretty rough days, and can we enter into that space together and be kind and be caring and recognize whatever's going on for that person and to sit there with them together.
There was one group when we had just gathered everyone together and we were supposed to talk about journey, and I gave just a short introduction to help people settle. And then I asked people to go around the circle and identify one person in their lives who had made a difference in their spiritual walk. And this one lady started to talk and immediately broke down because the person most important to her had recently passed away. And the whole group just kind of embraced her, not literally but metaphorically, and I just got to watch, and it was wonderful.